Mr. Jones, my name's Kate. I'm going to be your nurse today. I'm going to provide us some privacy. I'm going to perform hand hygiene. I'm going to go ahead and raise this bed to a good working height and lower the side rail. Mr. Jones, can you verify your full name and date of birth for me? George Monster Jones, 101XX. Okay, I'm going to verify that against your armband. So I have George Monster Jones, 101XX. George Monster Jones, 101XX. Okay, perfect. So Mr. Jones, today I'm going to be inserting an IV catheter into your left arm, okay? All right. So what I'm going to do now is go ahead and get my extension tubing and my lower lock. Grab my pre-filled syringe. Take the cap off of this. Insert that here. Now I'm going to prime the tubing. Okay. I'm going to put that within reach. All right, Mr. Jones. Have you ever had a mastectomy, a lymphectomy? Do you have any shunts or fistulas? Or have you ever had paralysis? No? Okay, great. So I'm going to go ahead and put on my clean gloves. All right, Mr. Jones. So now I'm going to go ahead and I'm going to apply a tourniquet on your arm. So I'm just going to put this rubber band around your arm and I'm going to make it a little tight just to help your veins pop up good for me, okay? You just let me know if this hurts at all. Okay, now that I have the tourniquet in place, I'm going to palpate for a vein. And I'm going to use this vein right here. It's nice and spongy. Okay. Now I'm going to grab my alcohol prep swab and I'm going to clean the injection site for 20 seconds in a circular motion. And I would let that dry. And now I'm going to take my betadine swab and also clean in circular motion for 20 seconds. And I would let that dry as well. Now I'm going to grab my IV catheter. I'm going to remove the cap. I would make sure that my bevel is up, and I'm going to anchor the vein about 1 to 2 inches below the insertion site. All right, Mr. Jones, you're going to feel a big stick here, okay? I'm going to insert my needle at a 10 to 30 degree angle. I see flashback, so I'm going to advance the needle another 1/4 of an inch, and I'm going to advance the catheter. And activate the safety mechanism. And go ahead and pop that tourniquet. And go ahead and attach my pre-filled syringe here. And I'm going to aspirate for blood return. And I do see blood returns, and I'm going to go ahead and flush. Okay. Now I'm going to grab my transparent Tegaderm. making sure to not touch the inside of it. Now I'd place that over the catheter site. Okay. Now that I've done that, I'm going to remove my solution, my pre-filled solution, and making sure to leave the lower lock cap intact. I'm going to grab my tape and I'm going to loop the tubing up here and tape it in place. Okay. Now I'm going to write the date, the time, and my initials on the label. And I'm going to label over the transparent dressing. I would dispose of all of my sharps in the appropriate sharps container, and dispose of all of my trash. Remove my gloves, dispose of my gloves. I would lower the bed back down into the lowest position. I would raise the side rail. Here's your call light, Mr. Jones. You just press that if you need anything at all. Perform hand hygiene, and I'll be back in to check on you shortly, okay?